Dental cap, dental crown. Sounds the same, right? But what if I told you choosing the wrong one could cost you years of comfort, money, and even your smile? Today we're opening a door most people never look behind. And Dr. Esma, dentists don't always explain this clearly, do they?
Honestly, Rasim, not always. Many patients think a cap and a crown are interchangeable. They're not. The difference can affect how long your tooth lasts, how natural it looks, and whether you'll need retreatment later.
That's exactly why you should keep watching, because in the next minutes, we'll expose what these terms really mean, why people get confused, and the one question you must ask before saying yes in the dental chair. Let's make this real. You go in with a cracked tooth, the dentist says, we'll put a cap on it, and you nod like you fully get it. A few weeks later, something feels off. Sensitivity at night, pressure when chewing, that quiet worry you can't explain.
Rasim, I see this all the time. Patients think the problem is their tooth, but often it's the wrong solution. A cap that was meant to be temporary stays too long, or a crown is placed without explaining what it really protects.
And then comes the surprise follow-up visit. More drilling, more stress, more time gone.
Exactly. That confusion is avoidable if you know what to listen for before treatment starts.
So this isn't just about terminology, is it, Dr. Esma? One word can change the entire outcome. One.
Exactly, Rasim. I have seen patients who kept a temporary cap for months, thinking it was permanent. The tooth underneath weakened, bacteria slipped in, and suddenly a simple fix turned into a major procedure.
That's the scary part. Same chair, same tools, but totally different future.
Yes, a proper crown protects the tooth long term, spreads chewing forces, and preserves your natural bite. When the wrong option is used, the risk isn't immediate pain. It's silent damage over time.
And that's why understanding this now can save you from regret later. Alright, Dr. Esma, give us some background. How common is this mix-up, really?
More common than people think, Rasim. In my practice, nearly half of new patients tell me they've had a cap. But when we review their history, it was meant to be temporary. One mini case I remember clearly, a busy professional who delayed the final crown for months, thinking everything was finished.
Let me guess. Life got busy, the tooth stayed quiet, and then suddenly, trouble.
Exactly. By the time discomfort appeared, the tooth structure had already weakened. What could have been a straightforward crown became a far more complex situation.
That's a powerful lesson hiding in plain sight. As we tell the said these ladies with sight. And also That's a powerful lesson hiding in plain sight. Alright, Dr. Esma, let's put on the science glasses for a moment. What's really happening under the hood?
Great question, Rasim. From a biological standpoint, a tooth with a proper crown is sealed and reinforced. The crown redistributes bite forces evenly, protecting the remaining tooth structure and the nerve underneath.
So it's not just a cover, it's structural engineering.
Exactly. A temporary cap, on the other hand, is porous and weaker by design. It's meant to protect briefly, not to block bacteria long-term or handle years of chewing stress.
Which explains why problems often show up quietly, months later.
Yes, science doesn't punish immediately, but it always collects eventually.
Alright, Dr. Esma, let's flip the script. If someone is sitting in the dental chair tomorrow, what should they do step by step?
First, Rasim, ask one clear question. Is this temporary or permanent? That single sentence changes everything. Second, confirm the timeline. If a crown is planned, know exactly when it will be placed. Not roughly, but specifically.
So clarity beats assumptions.
Always. Third, understand the purpose. A temporary cap protects briefly. A crown protects for years. If you feel pressure to rush decisions, pause and ask for an explanation in plain language.
Simple steps, but powerful.
Exactly. In dentistry, informed patients get better outcomes.
Now, let's talk about the landmines. Dr. Esma, what are the biggest don'ts people fall into?
First, Rasim, don't ignore silence. Just because a tooth doesn't hurt doesn't mean it's safe. Damage under a temporary cap can grow quietly. Second, don't assume follow-up will happen automatically. Life gets busy, and months can slip by.
That false sense of security is dangerous.
Exactly. Also, don't treat a temporary solution like a long-term one. Avoid hard foods, keep hygiene meticulous, and never postpone the final crown appointment without a clear reason.
So, the do's are awareness, action, and follow-through.
Yes, those three prevent most regrets I see.